is WVVA in Focus, a weekly program about important issues and events in the two Virginias.
Good morning, everyone, and welcome to this edition of In Focus. I'm your host, Melinda Zosh. This morning, we're discussing what we're going to call an important medical message. Three medical professionals are joining us on set. Dr. David Eels is a general surgeon and is affiliated with Welch Community Hospital. Charlotte Buckner is a nurse practitioner who works at the surgical clinic at Welch Community Hospital. And Dr. Frederick Barker, who was featured on In Focus recently, is a board-certified surgeon with an office in Bluefield, Virginia, who works at both hospitals. Before we get into our question and answer segment with the medical professionals, I want to share some background with our viewers. So we've been facing challenging times during the COVID-19 pandemic. It started at a time that was heated and yet near equally divided. There was a lot of political polarization in the U.S., and a new virus emerged in December 2019. There were so many unknowns, so much we had to learn about COVID-19. We needed the best of our scientific community for them to deliver their knowledge and to do so as soon as they possibly could. Developing and implementing a successful strategy to end the pandemic was made even more difficult by the proliferation of politicized misinformation and also disinformation about vaccines and treatments. In fact, this became so widespread, it was in effect an epidemic on top of the pandemic. So when doctors have serious questions about issues affecting their own health, most of them will consult physician experts and sources they trust. So again, today we're going to hear from three area medical professionals on how they go about getting reliable healthcare information and avoid being fooled by unreliable information and also unreliable sources. So Dr. Barker, I'll start with you. We just talked about the pandemic. What do you think is the most important information that you'd like our viewers to know, and maybe also just to talk about some things floating around that just aren't true?
Well, I think that the first and foremost important thing to say is we really have the answer right at hand to dramatically improve what the outcome is, and that's taking the vaccine. And I realize that some people remain hesitant about that, but one of the things that I think is particularly frustrating for the medical community is to recognize here we have something that has been shown to be so effective, and yet many people aren't taking that. And I think the numbers bear out the fact when we look at who's being hospitalized nowadays, 85% of the people who are being hospitalized have not been vaccinated. And I think that both Dr. Eels and Charlotte have seen this really firsthand at Welch, because being a smaller hospital, they are absolutely on the front lines and have so little reserve that it really straps the hospital and straps those working. And I'd really think it would be interesting to hear from both of them on the effects that they're seeing.
Yeah, I agree with you, Dr. Barker. Let's let Dr. Eels jump in here and then Charlotte. But Dr. Eels, as Dr. Barker mentioned, you've been on the front lines in McDowell County during the pandemic. So share with our viewers some of the things that you've been seeing firsthand.
Well, I think the first thing to understand is that all the doctors who are treating patients today, this is the first time we've experienced anything like this. I've never been in a pandemic ever. And we have an illness that we're all learning about, brand new. And so the information on this is being changed weekly, monthly. Sometimes it was in a daily change as to what we were going to do. The fact that we have a vaccine is at such a quick time is just amazing. And I think when I see people questioning the vaccine, I don't think they've seen patients who become ill. I happen to be 70 years old, and so I'm one of those people who are perhaps high risk. And as much as I hate getting injections, having seen patients with the virus, I got my vaccinations and my second shot and my booster quite willingly, because this is an illness that you just don't want to play with. If you can avoid it, you just have to do everything you can to keep it away rather than treating it when it's there. Our treatments are, we don't have definitive treatment for it. We have some medicines. I don't want to say we don't have, no medicines, but after remdesivir and ivermectin, it's vitamin C, zinc, vitamin D, a lot of vitamins, and then I think a lot of prayer. And so this is something that that when people call me and ask me, should I take the vaccine, I'm emphatic that I think they should. Now, I want to also add that my daughter called me and asked me if her child should receive the vaccine. Now, I'm at risk, and so for me, I don't think there's any question. However, younger people, there is a question as to what the long-term effects are, and that's being learned day by day. And so, so my recommendation to her was, let's watch this a little bit. The children are not as much at risk as older people, and people with comorbidities. I think the lesson to be learned from what's going on is that comorbidities mean something. The majority of people who are dying are overweight, have diabetes, heart disease, and perhaps the biggest comorbidity is just age. And so I think trying to look at everyone's future, making certain that you try to stay healthy, hopefully will make you less at risk for dying from something like this. And there's a distinct possibility somewhere in the future, I wouldn't be able to say when, another pandemic may occur. And so managing those comorbidities, I think, is very important. And those are things that patients can do today, starting today.
Mm-hmm. And Dr. Eales, I have a quick follow-up question for you, and then I'll get to Charlotte with a question. But you said something important that I feel like we don't talk about a lot in the news, is like what happens when you actually get COVID. You don't hear about that as often, but I've done some research, and from what I understand, it's a horrible way to die. Can you elaborate on that a little bit for our viewers?
Well, they call it pneumonia, but it's a different kind of pneumonia. The typical pneumonia involves bacteria getting into your airway and causing an infection. It is bacteria that we are able to manage fairly well. This is a virus, and it tends to attack the part of the lung where air exchange occurs. Most of the pneumonias that we treat are bacteria that involve the airway rather than the part of the lung where oxygen exchange and carbon dioxide exchange occurs. That area, when you can't maintain oxygenation or maintain a low level of carbon dioxide, all of a sudden your level of oxygen in your blood goes down, and that's the biggest thing we see. The patients are literally asphyxiating from lack of oxygen. The biggest, and part of the determination as to whether or not patients are admitted to the hospital or not is what their level of oxygen is, especially in the emergency room. They may come in with a positive COVID test, but if their oxygenation is well, and a lot of people, this virus goes through them fairly benignly, they don't meet criterion for admission. But the minute your level of oxygen goes down, you are at risk from dying, and it is significant. And on top of it, this is not a 3 or 4 day hospitalization. This is weeks that you wind up in the hospital. This is an illness that is different than the stuff that we've seen in the past. So I have I have tremendous respect for it, and that's why I'm a big fan of vaccinations. I sure am. Now, whether or not it's going to be safe for children or younger people, I guess that's going to have to be watched over time. However, people at risk, such as people with advanced age, obesity, lung disease, heart disease, these people should look at this as something that not a silver bullet, but at least something to avoid getting into the situation that how many millions of people are in the United States, hundreds of thousands of people have succumbed to.
Very important information. We have to take a quick break. We'll be right back after this. Good morning, everyone. Welcome back to this edition of In Focus. This morning, we're calling this a very important medical message. I'd like to welcome back our three guests, three area medical professionals. David Eels. Dr. David Eels is a general surgeon. He's affiliated with Welch Community Hospital. Charlotte Buckner is a nurse practitioner who works at the surgical clinic at Welch Community Hospital. And Dr. Frederick Barker is a board-certified surgeon with an office in Bluefield, Virginia. So, Charlotte, I want to continue the conversation about talking about COVID and vaccines. In your experience working in Welch, what have you noticed as far as perhaps vaccine hesitancy?
Well, I think most people feel that their concern is the vaccine was a bit rushed. Their concerns is maybe there wasn't as much research as they would have liked. But that's just not, I don't know if that's the case. I think there's been much more research and behind-the-scenes work than for coronaviruses in general, and that plays into this vaccine as well. For parents, I think their biggest concern is the reproductive health of their children long-term.
So where do those concerns come from? Because I've heard that before, and I've seen that circulating on the internet as far as reproductive concerns in children and even adults. Where is that coming from?
I think it was misinformation in the beginning. I haven't seen any literature to support long-term effects in the reproductive health. In fact, the vaccine is recommended for pregnant women if they need it, and for women pregnant who are at risk or high-risk pregnancies. They recommend the vaccine.
And Dr. Barker, would you like to jump in here too and just maybe debunk some of the things that you've heard that might be circulating that's just completely false about
Well,
COVID?
I think that the main thing is going to good information sources. And I think that reliable information sources are those that are not politically attached, let's say. Those are the ones that come from the CDC and the National Institutes of Health, the World Health Organization. One of the things as far as the vaccine being rushed, I just have finished a very interesting book that is by Greg Zuckerman, A Shot to Save the World. And it talks really about the history of the development of vaccines. And it's been going on for a very, very long time. It's quite an in-depth dive into that and quite an interesting book. But I think that it's really important to go to the reliable academic centers because these are not folks who are politically motivated to give advice one way or the other. It's important to understand that there is a lot that's not fully understood. So ideas do change. One of the things that was, the problem was about the changing recommendations for masks. And I think that was really a twofold thing. When it was recommended that people don't generally wear masks, one, the supply of masks was low, and we didn't really understand, we didn't really appreciate the asymptomatic, in other words, no symptoms, and still someone could be infectious. When that changed, when that understanding changed, then there got to be a change within the medical community about recommending masks.
And also, Dr. Eels, I have a follow-up question for you based on pediatric vaccines. Would you recommend then that parents contact their child's pediatrician to get the best advice on whether or not that child should be vaccinated right now?
Oh my God, yes. And but I think, you know, we're looking at two different things. One, we're looking at the long-term effects of this vaccine. I think you got to weigh the long-term effects versus the short-term implications. The short-term implications, if you get sick, you can die. This is a real illness. And the long-term effects, I think, are yet to be displayed, and we don't have enough information on it. And for children who don't have the comorbidities that older people have, they seem to do much better or are much more resistant than the older population. And so for them, if there's any risk, a long-term risk, I think they can perhaps weigh it or discuss it, and you know, they may elect not to get vaccinated. However, the short-term risk, especially for people at risk, is possibly death. And from my point of view, that makes the vaccine indicated for the majority of people.
And Charlotte, also, can you jump in here and maybe tell us more about some of the disinformation you've heard? We talked about it a little bit, but what else have you heard, being in the medical profession, from people in McDowell County, as far as maybe just why they're just not seeming to trust science, it seems like?
Well, I mean, I've heard many things. I mean, even things as crazy as the vaccine had a tracking device in it so the government could track you. And believe it or not, there are some people, I guess, that truly believe that. But I don't know if they don't say specific things. It's just they feel the vaccine was rushed, and they have such uncertainty about it. But also, I think they may not have seen the true effects of the illness. And if they did see it firsthand, I think their opinions would be different.
Yeah, I think that this is one of the things that's kind of complicated, because realistically, the likelihood of dying from COVID is only about 2%. So it's not like having Ebola, where about 50% of the population that would get infected with Ebola would die. So many of us don't really see, we know it's going on, but we don't really see it. I think the other thing that is important to recognize is that we've become a society that likes to get our information in 30-second sound bites. And that probably doesn't work well, and it also depends on who you're getting it from. So when you're listening to the news and hearing the politicians talk about it rather than the medical professionals who are really on the front lines with this and on the front lines of research with this, I think some of the wrong impressions get made. And then once impressions get made, they're very hard to change.
Yeah, definitely, and that's why I'm a journalist. I've been doing this for a while, and you know, people can just get one thing out of a 30-second soundbite, and it's just not the full story. So I'm really grateful for the three of you for coming in today, and the fact that we have 30 minutes to talk about this very important topic. We do have to take another quick break, though. We'll be right back after this. Good morning, everyone. Welcome back to this edition of In Focus. This morning, we've been talking a lot about the pandemic, COVID, and vaccines, but there's some other really important topics and things going on in our area as far as screenings and other medical information that's crucial for you at home to know about. So I'd like to bring back in our panel of guests this morning. Dr. Barker, I'll start with you. So let's talk about this new screening in Welch.
Well, you know, Welch has fully operational clinics and obviously an operating room and an inpatient facility. One of the things that I find very exciting is they have now joined the ranks of the rest of the facilities around having 3D mammography. And I think that one of the things that I've been particularly concerned about with the pandemic is that patients have been much more reluctant to come to the doctor for a whole host of things that they would normally do in their health maintenance. And so some of the things such as screening for breast cancer, screening for colon cancer have been put on the back burner. And now hopefully we're getting back to doing that. And Welch now having 3D mammography, I think, is terrific. And I'm even going to be going down and having a clinic down there to make maximum use of that. I have many patients that come up and see me from Welch, and so I'll be happy to see them down in Welch. And transportation seems to be one of the things that really is a problem for patients in McDowell County, and I think both Dr. Eels and Charlotte can talk to that. I think that is a challenge, and hopefully we can overcome some of those.
Yeah, definitely. Dr. Eels, do you want to jump in here and then we'll get to Charlotte?
Well, this pandemic literally closed down our operating room for an extended period of time. They did not want us doing elective operations. They wanted to save all the beds for an expected overflow of patients with the virus. And as I said, this is an illness that is different than a typical pneumonia. These patients come into the hospital and stay for an extended period of time. So a lot of things that people would have for screening, such as colonoscopies, EGDs, mammography, were put off, because to avoid firstly a lot of traffic in the hospital, and two, to save the beds for COVID patients. We seem to be seeing a diminution in the COVID population in the hospital, and so our operating room is now opened up, but it just opened up just last week, and we're trying to catch up on cases that people have put off for months. I mean literally 8-9 months, and so I think a lot of things have been put on the back burner, and I hope we haven't missed a colon cancer or a esophageal tumor or anything that is dramatic because of the emphasis that was placed on the virus. But we're now opened up, and we're trying to screen these patients, and Dr. Barker's presence has been a blessing to us. I think having someone whose expertise is in breast is wonderful for our hospital, and we're going to definitely use him.
And Charlotte, do you want to jump in here and just kind of add to what Dr. Barker and Dr. Eels just said?
Sure. So in addition to seeing surgical patients, I do primary care as well, and definitely our clinic numbers, our outpatient services declined during the last year, and we are starting to see the volume increase, and we're encouraging patients to now get their preventative screenings and mammograms, colonoscopies. So hopefully we'll get to as many people as we can to get them the services they need.
And Dr. Barker, can you also just emphasize the importance of getting these screenings and not putting them off?
Sure. I think that particularly in the last segment of In Focus, where we had a patient who clearly, if she had not had her mammogram, and this is a young woman, a cancer that is very curable, would have been in a situation that would potentially have shortened her life by a lot. And so I think it's important. We've come up with pretty good guidelines for screening, although there's been some discrepancy. And I think that one of the things that was particularly problematic, and this is the reliability of healthcare information. In 2009, a group called the U.S. Preventive Services Task Force, who you would think would give out reliable information on screening, was saying that women shouldn't start screening before 50 and then have it every 2 years. Well, there were no breast cancer treating experts on the panel, and there are very good reasons to be starting at 40 and doing it every year. So I think that this is part of the problem. People have to seek out reliable information. That means go to multiple sources, go to multiple academic sources. The academic sources aren't nearly as influenced by the politics of the day. So I think it takes a little bit of searching to do, but it's not hard. And that's what I would encourage people to do, and talk with your doctor and get some help on what sources are reliable.
All right, thank you so much, Dr. Barker, and we're quickly running out of time on this edition of In Focus, but again, I want to thank our guests, Charlotte Buckner and also Dr. Eels for coming in, and Dr. Barker for facilitating this interview. This is crucial information for you folks at home related to COVID, the pandemic, vaccines, and also just the importance of getting your screenings and just what's going on locally down in Welch. So thank you again for watching. That does it for this edition of In Focus, but be sure to join us every Sunday at 9 a.m. And if you have an idea, if you'd like to be featured on In Focus, you can send me an email. That's mzosh, M-Z-O-S-H, at WVVA.com. We hope you have a great day. That does it for us.